Good morning, everyone. Thank you so much for being here today to talk about food security and access, especially related to disability, gender and sexual identity, and other related determinants and those barriers to food security. So I think, are we ready to get started? All right. So I am just going to share, see how this goes. Where do we go? Slideshow. Okay. From the beginning. Can everybody see my screen and everything that's going on here? All right, great. Yeah, so my name is Mallory Hudson. I will be moderating our panel today, and our panelists include Steve Preston and Washieka Torres. So I'm going to start by introducing myself, and then I will let our speakers introduce themselves, and then Steve is going to get us started. If I can figure out how to get to the next slide. There we go. So like I said, my name is Mallory Hudson. I work for a nonprofit in Pittsburgh, Pennsylvania called Community Living and Support Services. We provide home and community-based services to people with disabilities and older adults. So these are the types of non-medical supports that keep people out of institutional settings like skilled nursing facilities, intermediate care facilities, and state hospitals, which are still slowly shutting down. My background is in public health and social work. So I have experience working in community mental health, hospitals, and of course, like I said, home and community-based services. And I also forgot to mention I use she, her pronouns, and I wanted to include a visual description, and our other presenters are going to do the same for any of our audience members who may be blind or low vision. So I'm a white woman with long brown hair. I have bangs and a green long sleeve shirt on, and there's some plants in the background behind me. So Steve, you can go next.
Great. Hi, everyone. My name is Steve Preston. I use he, him, his pronouns. I am the Chief Program Officer at Share Food Program. We're the largest independent food bank in Pennsylvania. We mainly serve the southeastern Pennsylvania region. And I am coming to this role after working as the first Deputy Chief Diversity, Equity, Inclusion Officer at the City of Philadelphia. I started my career as a community organizer and now serve trying to make food insecurity not an issue anymore in southeastern PA. I am a white man, early 30s, dark hair, wearing a black polo, and I have some beautiful plants in the background as well. Thanks.
Washieka, would you like to go next?
Hi, I think we lost the slide deck, but
oh, no.
My name is Washieka Torres. I'm now a 6th year PhD student. My 5th year here, but it'll turn into the 6th because academia times are weird. I'm a disability rights activist and scholar. I am currently based in Chicago, where I am doing my graduate work. I'm also a grant writer, public speaker. I've taught classes in disability, art therapy, and public health, especially as it relates to various types of disparities when it comes to public access or access to services. I am an Afro-Latinx person. I use all pronouns. I am currently sitting at home. I don't have plants, just letting you know. I have cats. I made a choice, and that was the choice I made, and I'm going to stick with it. But I'm an Afro-Latinx person with a short afro. I'm wearing a red dress, and behind me there is a red, gold, and black abstract piece of art. I'm also an artist. I do a lot of multimodal work so that people with disabilities can access my work in different ways, and other people can as well. I recently did an exhibit where you could actually, it was about like the ocean and microplastics, and you could actually smell the work. I was very proud of that exhibit. But yeah, so that is me.
Thank you. I'm going to briefly end the PowerPoint just to see if I can get us all back on the correct screen sharing. Okay, I'll try this one more time. And then I'm going to briefly just introduce our general topic, food insecurity, and then we'll hand it off to Steve and Washieka, okay? All right, can everybody see what we're doing over here? All right, so next we're just gonna, bring up food security. So what is food security? We're mostly talking about food insecurity today, but obviously the goal is to become secure in our access to food and nutrition. So food security is when all people at all times have physical and economic access to sufficient, safe, and nutritious food that meets their dietary needs and food preferences for an active and healthy life. So there's kind of 4 dimensions of this. You have your physical availability of food, the economic and physical access to food, which is a lot of what we'll be talking about today, food utilization, and then obviously stability of all of these factors over time. Food insecurity is kind of a household level measure of, it's an economic and social condition of limited or uncertain access to adequate food. So on the right here, we have a little chart that describes some different circumstances, and they're kind of stratified. It's a little bar chart. They're stratified by folks who are food secure versus people who have low food security or very low food security. So it goes over, people who are food secure don't really experience too much like weight loss or hunger. But, as we get into those higher levels of food insecurity, then, we have folks seeing that they're worried their food will run out, or they'll buy food and it just doesn't last. They couldn't afford a balanced meal, cutting the size of a meal or skipping meals. Those are kind of some of our measures. So obviously today we'll be talking about the social determinants of health. I think a lot of people on this call today are pretty familiar with this, but I'll just briefly touch on it. So the social determinants of health are the non-medical factors that influence our health outcomes. So they're the conditions in which people are born, grow, work, live, and age. And these like wider set of forces and systems that shape the conditions of our daily life. So these forces and systems include like economic policies and systems, development agendas, social norms, social policies, and these, create circumstances where people are exposed to things like racism or homophobia or transphobia that, change the way they can and limit their access to food. So next we'll go to Steve, who's going to tell us a little bit more about, food access and food insecurity in the LGBTQIA+ community.
Great, thank you. So I figured I would just get started by talking a little bit about poverty overall in the LGBTQ community, and particularly in comparison with the cisgender heterosexual community. So on this chart, we can see that the percentage of people living in poverty for the cisgender heterosexual community is 16%. Then the chart shows a steady increase as we talk about LGBTQ identity. The overall LGBTQ community has about 22% of people living in poverty. And then as we get into the transgender community, we see it rises to 29%. And then Black trans adults up to 39%. And Latinx transgender adults up to 48%. And so this is a healthy base to start from, because poverty is a root cause of food insecurity, obviously. And if we move to the next slide, there's a little bit more in-depth information about what food insecurity looks like in the LGBTQ community. And so again, this kind of echoes what we saw in the poverty numbers. We see that straight men, all the way on the right of the graph, 7.5% of them face food insecurity. And then it starts to, women next with 8.1%, gay men at 10%, lesbian women at 12.4, bisexual at 12.7, bisexual men at 14.2. And then with the trans community, it goes up to about 20% of the community is facing food insecurity. On
So
the
Steve,
next, oh, go ahead.
sorry, I was going to say, Steve, how do folks in these communities then access food since they have such high rates of insecurity?
Yeah, so food access is, and we'll talk a little bit more about some of these things in a little bit, but the way that folks access food is traditional benefits like SNAP, which we also see lower enrollment rates for folks in the LGBTQ community. Access to food pantries, which is, again, another, I can get a little bit more into it now, but there are many barriers that face the LGBTQ community when they're going to food pantries. And we see on this next slide, outlines, oh, sorry, go back to that last one. That's the one I was referencing, my bad. So as we factor in the intersectional identities, we see that food insecurity rises. So communities that are traditionally hit very hard by food insecurity, when you add on different factors, so particularly white non-LGBTQ folks, about 78% of them said that they have enough food on a regular basis. Once you start talking about the LGBTQ community, you see 66.7% of people have enough access to enough food. And then when you start talking about people of color, 62%, and then LGBTQ people of color is 54%. So we see that these identities compound. And we saw in one of the previous slides that gender identity also plays a factor into access to food. And as I said before, lower usage of SNAP benefits is something that we see because people don't feel as comfortable with government programs very often. And so to the next slide, what we see is many of these people who are accessing pantries don't feel extremely safe at these places. A lot of pantries are churches. They're in unfamiliar neighborhoods. People feel like they need to be closeted when they're going out to the pantries. And, even we run a pantry network of about 250 pantries, and we get complaints of discrimination for various things, but LGBTQ identity is one that we see sometimes. And then again, this goes intersectionality, the other identities also, things that might make people feel uncomfortable going to a pantry already, these compound when you add intersectional identities. And then there are traditional barriers that people already face, substance abuse, which is higher in the LGBTQ community, and then onerous paperwork. People often don't feel safe because to receive state or federal food, you have to provide a self-declaration of need form that provides some basic info about yourself. And putting information like that down on paperwork can be a trigger for some folks. For some folks who are LGBTQ, might have some issues with the people who are administering the paperwork and not wanting to out themselves in any way through that. And then we see other traditional issues that these communities face, right, which is discrimination in signing up for benefits, lack of access to transportation, and we think of this particularly more in rural areas, and then housing, which is a huge issue in food insecurity, right? Because when you're thinking of a lot of the foods that are given out at pantries or different places, oftentimes it's canned goods, it's meat. You need a place to be able to cook those things. And so a housing crisis for the LGBTQ community means less access to food, which is also one great thing about food rescue, particularly if you're partnering with restaurants that are already serving pre-prepared foods. This gives folks an opportunity to just be able to heat something up instead of having to figure out a way to cook something that might be in a can or something else like that.
Mm-hmm. So I guess food, the ability to store food, to use various appliances to safely prepare your own food. our built environment is something that's impacting people's ability to get the food that they are getting at, or use the food that they're getting at pantries, right?
Yeah, and unfortunately at this point, most of the government programs that provide food focus a lot more on foods that need to be cooked.
Mm-hmm.
And while, that's helpful in a nourishing way, unfortunately that leaves a lot of people behind who don't have access to things like you just mentioned to be able to cook.
Mm-hmm. And then you mentioned before, a lot of these like less, not our like formal food networks, like our SNAP benefits, right? Or our SNAP benefits. We have all these food pantries that your organization partners with and run independently, and a lot of them are at churches. And why is that an issue for our LGBT neighbors?
Yeah, a lot of people in the LGBTQ community don't necessarily have a great relationship with religious institutions. And so when they go there, regardless of if the church may be supportive or not, or the organization may be supportive or not, people feel like they need to be closeted. And so, as a member of the LGBTQ community myself, I've encountered this. It's really about your perspective and how you feel going to a place sometimes. And so people feel like they're going to an unfamiliar place and they can't necessarily be themselves.
Mm-hmm. And then how is someone's immigration and documentation status impact the way they access these other like less traditional food networks?
Yeah, I think that we see kind of some of the same issues with paperwork, right? As soon as a piece of government paperwork is thrown in front of someone who might be undocumented, that right there can be a moment of terror, honestly. And so one good thing and something that we prioritize as an organization is that these are self-declaration forms. So people are allowed to, self-declare whatever they'd like. And we try to make it very clear to folks that they don't necessarily have to put their real information down if they don't feel comfortable. And so that's something that we've been pushing to try to make sure folks feel a lot more comfortable going to pantries.
I think a lot of folks using pantries have maybe applied for different government benefits in the past, like SNAP or something like that. Obviously, there can be consequences that aren't usually acted on, but there are consequences on the forms if you lie on those. How would someone know, if it's okay to omit information to a food pantry versus, like an application for like a government assistance program?
Yeah, I think that they're pretty distinct. I would say that for the self-declaration of need forms, we make sure that our pantries are trained on knowing how to handle situations where folks might not feel comfortable filling out paperwork. And so we've trained folks basically on the mentality that I just talked about, right? Which is that if you don't feel comfortable putting all of your information in there, you're allowed to self-disclose whatever you'd like. And for the other government programs, obviously that's a lot more tricky of a situation. And so we have organizations like the Coalition Against Hunger in Philadelphia. And those organizations can help people navigate the benefit process. And so they can help people understand when it's appropriate and what's appropriate to put on those forms.
Mm-hmm. Okay. And then obviously we're talking about paperwork. How does paperwork impact the organizations that are trying to bring food to folks who are food insecure?
I would say that about 90 to 95% of our pantry partners are run by volunteers. And so that adds another layer to all of this, right? When we talk about, training people on competency with the LGBTQ community or any marginalized community, it becomes a lot more difficult when you're dealing with people who have a full-time job already and are kind of doing this out of the goodness of their heart. And so you have to find ways to engage people to do these kinds of trainings that makes them feel like it's more beneficial to them as well. And obviously they want to serve the communities that they're already serving. But a lot of this stuff is just additional things that we're piling on their plate. And so when we talk about the paperwork, if every individual who's coming into a pantry has to sign a piece of paperwork that says they meet the need, that means that the pantry itself is having to gather all of those. They're having to gather all the sign-ins. And ultimately, we have to report that to the government every month. So it becomes a huge burden for our partners. And that's exactly why actually we've upped our food rescue operation, because we are trying to decrease our reliance on government food because of all of the stipulations that are required with it. And so, the idea would be just giving people money to be able to buy food, which is the dream,
Mm-hmm.
But for now, we have to kind of work within the system that we're in. And so we try to provide as much support as we can to pantries. But by relying on food from food rescues, we're able to avoid the paperwork and have people who say they need food get food. And that's kind of our mentality. If someone says they need food, we're going to give you access to food.
I love it. You had said before, when we spoke previously, we talked about how, losing those additional STAP payments that were provided during the public health emergency, when that ended earlier this year, obviously a lot of people had a lot more needs, and that has changed the way you all have done things. And, you guys have had to diversify your sources, your food sources that you get out to people. So what kind of barriers have you faced in trying to diversify and find more pantries to partner with so that you can get people what they need?
Yeah, so the COVID relief funding ended a few months ago, and we saw about a 60% decrease in the amount of food we were getting from the government, which has, that is a very significant amount, which is again why we're increasing our food rescue operation. But we also had some programs during the pandemic that helped people a lot. There was a Farmers to Families food box program across the country. The boxes had no requirements on them, so anyone who needed one could take one. And it didn't have all of those government requirements. The other thing is that it didn't have the requirements for organizations as well. So right now you have to be a 501c3 to get government food. But we were allowed to give these to community organizations that might not have access to the 501c3 license, because they're not always easy to get. And so we were able to distribute, we could get almost an infinite amount of food through that program, which was wonderful. And so now we're back to, being cut 60% and having to increase our reliance on other types of food. Mm-hmm. I'm not sure if I quite answered your question. So
I think you did. Yeah.
Okay.
Oh, wait, no, other barriers that you've faced with, I know we've talked previously a little bit about ADA access. Obviously, a lot of religious institutions do provide these really important food pantries to our communities, but they're not always, as you said, safe for our LGBT neighbors. And they're not always physically accessible, right? Because they are often grandfathered into not having to follow ADA regulations. Are there any other big barriers that you guys have faced when trying to find new organizations?
Well, yeah, I think, physical access is absolutely a huge issue. In fact, there is a pretty physical aspect to running a pantry in general, right? Because we're sending pallets of food to someone, and that food generally needs to be transported somewhere. And so a lot of the folks who run pantries are seniors, are people with disabilities, and so they face those problems. But also, as you said, physical access to pantries is often a barrier. And I think particularly during COVID, we saw that there were huge barriers to access for people with disabilities. We actually started a home delivery program during the pandemic. We called it Knock, Drop, and Roll. Because we tried to limit contact with people. So basically we would have volunteers get a box of food, drop it off on someone's door. And that program, we focused on seniors and people with disabilities who might not be able to safely leave their homes during the pandemic. And so really, the ultimate goal in my mind for any kind of food insecurity work is to meet people where they are. And I really see home delivery as the future of that, right? Like you should be able to get like many people get their groceries delivered, people should be able to get pantry food delivered. And so that's what we're kind of working towards. We have a home delivery program with DoorDash now. We serve about 6,000 people per month that we do directly to their door. And we have partnerships with organizations like Liberty Resources, who's a disability advocacy organization here in Philadelphia. We also have a program that serves newly settled refugees with an organization called Nationality Services Center. And so we are really trying to pivot a lot towards home delivery to help better serve people with disabilities and seniors. And there's a lot of overlap in those two communities.
Mm-hmm. Thank you. So next, let's talk about action steps. What can people on this call and their communities do to, improve food access?
Yeah, I mean, one thing I would say is that we should continue advocacy and advocacy for a few things. There's obviously tiers of this. the dream, as I said before, is giving people money. Just give them money, let them live their lives, let them buy the food they want to buy. And so after that, obviously, which is a pie in the sky dream, increases the SNAP benefits. We saw SNAP decreases here that really affected a lot of people. And then if that's not it, increasing money that's given to nonprofits and other organizations to purchase food. So there are regional boards like the Emergency Food and Shelter Program that give out grants for people to purchase food. And those are for organizations and nonprofits. And then training. We provide a lot of training for our pantries around competencies with different communities. Philadelphia is a very segregated city. And so oftentimes when people are going to pantries, it might not be in their neighborhood and it might be a place they're quite unfamiliar with. And then really thinking about how we're overall, also how people view the LGBT community at large is something that clearly needs to be worked on if you even turn on the news. But there are just a lot of opportunities for training that are out there to help our pantries and help the people that we're serving.
Mm-hmm. I love it. So we've got obviously our advocacy, get people the money they need to buy their food, or increase funding for programs that get food to people. We have, compliance with the Americans with Disabilities Act that our organization should prioritize as much as possible. I think less well-known is WCAG compliance. So that's the Web Content Accessibility Guidelines, which is useful for when, we're promoting the important and difficult work that we're all doing online, for example. And yeah, I think, if you don't mind me jumping in, I think there's a lot we can learn from organizations that serve like the same people, but are addressing a different issue, right? Like in the harm reduction space, we talk a lot about housing first. People are never going to get into any kind of stable level of recovery if that's what they want to do, if they don't have a place to live, if they don't have their basic human needs met. So yeah, treating human beings like humans, kind of a big deal.
Novel, yeah.
What an idea. All right. Washieka, did you have any questions for Steve, or can we go on to you next?
I don't have any questions now. I know we have a question in the chat, and I think that
yes,
we can. I think that Steve can address it since I don't work for a nonprofit, but I also do have many ideas from listening to various people. A lot of the work I do is around storytelling and listening to people's stories and really the strength of a story, especially with organizations that I've worked with getting people out of institutions and into, which is their legal right, by the way, to be out of an institution in the community. So I think that we can either address that question now or we can address it once I'm done. So either way.
Yeah, Washieka, would you mind reading the question out loud? Just because I am actually not able to see any of the questions in the chat right now.
So someone asked, as a nonprofit, what are some concrete steps that we can take to promote an environment of inclusion?
Yeah, I would say one step is to start with your staff, to make sure that your staff's competent on all of this stuff. Oftentimes when there's any type of issue at one of our partner sites, our staff is the first line of defense, right? As soon as they have an issue, they'll come to us for advice. And so making sure that they're trained not only on competencies with these communities, but also on things like de-escalation. Unfortunately, as we've seen food resources cut, we've also seen increased fighting at pantries. And so we've had to really start to train folks on de-escalation, including our pantries. So we have regular monthly meetings where we train people on how to handle those situations and how to be competent with different communities. And really, again, everything starts within your own walls as an organization. You really have to make sure that the people in your organization know how to handle these situations. And then also making sure that that people are able to, I kind of lost it, but make sure that people are able to get out and interact with people who they might not commonly interact with. And so one thing that we found is like field trips for pantries, going to other pantries, checking it out, seeing the communities they're serving, just to be able to get a little bit outside, because a lot of pantries are serving their neighborhood because it's really community organizing at the end of the day. And so being able to see a different part, particularly in a city that's so segregated, will help people learn a little bit more about how to serve people they're not familiar with.
I love that. There was another question. So it's can you tell us about means testing? So I think they kind of want to know not only what it is, but the negative impacts it has, and the way it creates barriers.
Means testing. So when you apply for a government program like Medicaid or SNAP, you have to prove that you deserve help, right? That you are in need, and that can be doctor's notes. It can be your income, like bank statements, access to your banking information, things like that. And honestly, Medicaid, as an example, is very complicated. They have a lot of weird rules about how they count people's income versus their financial resources. And every state's Medicaid is different. And each type of Medicaid program has different rules for eligibility and counting all of that information or all of your financial stuff to see if you qualify. So when someone goes online and Googles, do I qualify for Medicaid? They might think that they don't when they really do. We could probably communicate this information to people better. There are some organizations that do that very well. I think the Pennsylvania Health Law Project does that really well. They do the math and tell you like, okay, after this deduction and that deduction and X, Y, and Z, this is actually the amount you can make every month of your earned income. And this is what you can make from your unearned income. And you can have this much in resources for each program. And it varies a little bit if you're married or not too, which also decreases people's access because, if someone's married and their spouse works, then they might not be able to get benefits because their income might be too high. But having two adults and maybe potentially children in the house, that's really difficult to do on one income. So a lot of people don't apply for things because they think they aren't eligible. And a lot of people are denied things because the paperwork is very complicated. And so for an example, again, in Pennsylvania, we have a Medicaid program for workers with disabilities. So I'm someone who qualifies for this program. I work full time, but I have diabetes. I take insulin. So I need to always have access to insulin so that I can work. And there's a form that you have to complete for the Workers with Disabilities program. And there's a little open-ended, short answer section where they say, please explain why you cannot work under any conditions. And that's not, I can work. I just need access to insulin. I just need to make sure that that's always available to me. So even the way the forms are designed doesn't make any sense. And then the follow-up communication that people get from their county human service offices, a lot of those are computer-generated forms, and they're very confusing and they don't make a lot of sense. So people don't always know how to respond to them, or they might miss deadlines. It leads to a lot of people getting denied for things or just not even applying when they could access that. And then obviously you have to reapply every year. And then some states also have rules about, you can only get SNAP for 3 months every couple of years or something. Or you can only, in Pennsylvania, I think you can only have it for a year without working unless you're on SSI, which is our income program for folks who have disabilities and don't have a work history, can't qualify for something like SSDI. If I said a lot of acronyms that were confusing, that's how the process is for people who don't even work in these fields. And it definitely turns a lot of people away.
I will say, for a glimmer of hope in the means testing, we've seen a movement away from having to prove things as far as government food goes. So the Senior Food Box program, which provides food to seniors every month across the country, they used to have to prove their income, like you said, and luckily it's gone to a self-disclosure of income. And so we're seeing at least a move in that direction for some things. Obviously, there's an infinite amount of work to be done on that, but it's good to see us moving in some direction towards self-disclosures instead of having to do all that burdensome work to prove your income, all of that stuff. So
it's a lot of work also. If no one here has applied for Medicaid before, it takes hours, like on a decent online platform like we have in Pennsylvania. Okay, we'll move on to Washieka next, unless there's another question in the chat. Alrighty.
Okay. So I will say this. So we are about like halfway through. We have a little less than 20 minutes. But I will also say that if anyone wants additional information or to email me, I'm very open to that. I love getting different types of questions. And I know that some people do take time to read and process things. So don't think that you have to ask every question now. You can come up with things later as well that are just as amazing and thoughtful and insightful. So what I want us to think about, especially in terms of the framework of disability, right, are these three ideas of food sovereignty, food justice, and food waste. So food sovereignty is the right of people to define their own food and to determine to what extent they want to be self-reliant, right? Do they only want to be able to cook for themselves? They want to have someone who helps them cook. Do they want to live with family that helps them cook? They want to live in a group situation with communal kitchens. Food justice, and that's a movement that seeks to address injustices that disproportionately impact people. And traditionally, those usually go around race and class, some with gender, obviously, but traditionally, people are talking about like race and class and the ways in which geography and colonialism and other forms of like history of oppression impact the way people practice those movements. So I like to think of food sovereignty as a destination, and then food justice is the journey, like the mechanisms that begin to get us closer to food justice. And so foodways are the eating habits and culinary practices of a people, region, or historical period. And so you will have there's different foodways conferences, especially in the South, and I've been to them and presented at them as well. But both of these movements around food sovereignty and food justice, and even the documentation of foodways, often leave disability out of the conversation. But the whole point of thinking about and rethinking about these things, or thinking about the ways in which we can center and look at disability and that form of discrimination and barriers and opportunities within the frameworks of sovereignty, justice, and foodways. So the entire food system as well. Can you do the next slide, please?
Mm-hmm.
Thank you. So these are some access issues I want people to think about, right? How do people with disabilities shop? And not just people with physical disabilities. How is someone, for instance, who is autistic or who is blind or who is low vision, how are those people shopping, right? And, how are those different disabilities affecting the way they shop, right? The question, do they need help? Right? Some places do offer customer service, but not during the entire time that a place is open. Those people are sometimes put on and off the floor, so you may not be able to find them. But here's another thing to think about. Do people with disabilities want help? Right? Is this a situation where some people want help? Because there's some people who do, and there's some people who don't. There's a supermarket right across from my university, and there are people who will shop there because that particular store has a lot of people with age-related disabilities, and they always have their customer service available, usually one or two people who work at the counter who will go and walk through the store with you and help you with your things, because they understand, because of the area they live in, the needs of people with age-related disabilities and other types of disabilities. And they also have different housing programs and different things like physical therapy and occupational therapy programs in the area, right? Are the services that are there reliable? So like I said, some places, like there's some supermarkets that are open 24 hours, but their customer service desk is not. Or you will call for customer service and they say, oh, they'll have someone, but when you get there, that's a problem. Especially if you're using paratransit, which you have to book the day before or early that day of. And if they leave you, they leave you. There is no other way of getting home or things like that. So also is the route accessible? So where I am, right, where I live currently, there isn't a supermarket within a 1 mile, right, walking radius. But that's because the sidewalks aren't very good, right, where I live. The buses, there's mostly buses, not trains. There aren't many bus shelters, or if there were, they've been taken down or the chairs have been removed. right? So, and I also do want to point out, and I know this is not something fully in the scope of, or we don't think of it fully in the scope of what we're thinking about, but anti-homeless architecture is also anti-accessible architecture. I do want you to think about that when they are taking chairs away or when they're making things uncomfortable, right? It is also, it creates an accessibility issue for people. I'm from New York, and we have lots of underground subways, and at one point they removed all the chairs. This was before the pandemic too, so they removed all the chairs. And I wrote a small story about it. I even contacted my local council person, and I asked, what happened to those? They said, oh, they're fixing them. When they replaced them, the fix was they removed the backs of them so people couldn't lean on them anymore. But they were the same. It was the same wooden structure. Nothing had changed. Nothing had gotten better. And it became fairly inaccessible for some people. And now there are also less of them. So more people with disabilities, you have to have a negotiation. Who has to stand, who has to sit? And then when the train is crowded now, who is leaning where and how? And those people have to get groceries too. Like, we need to get groceries, especially if you don't, like we said before, get approved for paratransit. Or other resources that you may need. Now you have to travel further outside of your neighborhood to get your needs met. Could you please go to the next slide? So I also so ethnography is the idea of listening to people's stories to get an idea of, where they come from, cultural similarities and things like that. I love a story. I love a good story. I think statistical data is good. I also love infographics. I love infographics. I love the idea of, also a lot of people are doing more plain language summaries, and infographics fall right into that. I know a person, especially when we're talking about, like, when COVID was a lot of misinformation around people with communities who did not speak English, for instance. Someone actually broke down all the things about COVID in plain language, some of these that were easily translated into many different languages. Okay, so we have about 10 minutes left. Don't worry. So COVID, it had a really big impact on people with disabilities. Stress and anxiety around empty shelves, right? Especially the only places they could go. People thought technology was more accessible just because it's technology. That's not true. A lot of it was really hindering rather than liberating and helpful. People with disabilities were left out of key decision-making things, including those related to food access and supplies, what people needed and where they needed it. But disabled people, as they tend to, relied on themselves and their own comfortability with technology and created their own survival circuits. I won't explicitly get into all of them, but some with different types of disabilities would help other people or share information or create documents to be more accessible when they only have like screenshots of information. But also remember that disabled people are the experts of their own experience, right? And we need to listen to them and center them in the decision-making steps to ensure equity and access. That also goes with emergency preparedness. A lot more people are now thinking about disability when we think about emergency preparedness, because not every person who is going to need emergency services or need to move or evacuate something has full access to do so. So can we just go to the last slide? Mm-hmm. So when we're thinking about actionable steps, we need to think about interdependence, right? We need to work on the ways that we can rely on one another and show material support for the ways in which disabled people access food and how their needs and wants, right? It's not just needs, like, oh, this person needs a thing. Okay, but what do they want? Because wants are also reflective of someone's capacity or someone's desire. Right. So if you give me something, say you need this, I don't want this. I don't know what this is. I don't know how to use it. And I was actually speaking to Amala the other day, and I was like, I actually didn't know growing up that my family didn't actually like vegetables. So I'm eating vegetables that my family was just like, oh, we never thought of that. Oh, we didn't like that. And I don't know how to prepare them. I'm looking them up. I'm hoping for the best. Sometimes it works out. Hopefully I have the money that I can experiment and try new things, but there's also a want. I have to want to try these new things and incorporate them and find a sustainable way to use them in my life, right? But also, like we mentioned, reflective of the environment around them. If you only have a microwave, how are you going to cook? If you don't have access to an oven or a stove, how do you cook? If you are newly disabled and you don't have access to equipment or services that can give you modifications to your kitchen or your home, how are you going to cook? How are you going to access food for yourself? What kind of settings do you live in, and what environment do you live in that And how do we make sure that your needs are met and wants are met through that environment? Remembering that, again, disabled people, they know what their needs are and they know the solutions. Like when I've interviewed people for different things, they have answers because they're living that experience. And it's really up to us to help us bring those ideas to fruition, bring those ideas to life. And I think another big thing is, right, we talk about action steps, right? We're talking about what actionable things we can do. And often people, and I know Steve talked about this, like often people will ignore bad policy or harsh treatment, like, oh, if we ignore it, it'll go away. Or, oh, you know, this will die out. No, bad bills get renewed. Bad things happen, right? But if we don't do anything, it will make it worse. If we are ignoring these issues of inaccessibility, inequality, and we go, well, it's not me, right? Or it's not affecting my family, right? But when it comes time to affect your family, you're not going to know what to do. There won't be enough resources or even information about resources, right? You know, be a part of letting people know what practices are immoral, what's unethical. If you see something wrong or someone being mistreated, say something, right? And I think that that's also another really important thing because we're all literally in this together. We're all in this. We're all here because we have a purpose and we want to help people. And, you know, just like when you talked about attitudes, there are many attitudes about disabled people, very paternalistic, like we know what you need, or we'll give you what you need, or I'm going to tell you what you're going to need. It's like, no, I know what I need, and I also know what I want, right? Like if I want to get snacks, right, then I want snacks, right? If I want something healthy, I want something healthy. If I don't know how to cook something and I don't want to learn how to cook it, I'm not. Or if I learned how to make something and it was bad, you know, that is what it is. And I want to have the freedom to be able to go, yes, I want this. No, I don't want that. So I did just want to kind of supplement or add to what Steve said from those perspectives. And like I said, centering and listening to disabled people. We have about 4 minutes left. So
Thank you so much for taking over the chat monitor. We appreciate it. Okay, let's see here. So, do we have any more questions? Do you guys have questions for each other? Does anyone in the chat have questions for us?
Well, I know someone asked about anti-homeless architecture. So I have not written anything personally on anti-homeless architecture. So the art that was the thing was like a letter. It was an article I wrote for school, but also a letter that I wrote to my local person. That was what 2012, 2013. So about over a decade ago was when I recognized the correlation. But there are a number of articles, and I do believe there's also a book on anti-homeless architecture that is now available. So it would be really great if you all wanted to look at that and focus on that. So I would I do encourage everyone to look into anti-homeless architecture all around, and what people have done to combat that as well. That's the important thing as well. What have you seen and what can you do? Where do you fit into this narrative as a member of a community, as a member of not just a local community, but a national community as well?
Mm-hmm.
Yeah, I also just want to comment on something Washieka said about wanting snacks and stuff like that. It's just such a big point because, you know, oftentimes, and sometimes you see this from folks running pantries as well, the mentality of like, you know, the beggars can't be choosers mentality. And it's just not, it doesn't make any sense, right? People facing food insecurity deserve snacks. They deserve to eat what they want to eat. And so I really appreciated you making that point.
I was actually, when I was speaking to Mallory, I actually was part of this thing called Community Cuisine, where I cooked for 4 disabled families in Chicago. And I made these large meals, and they included dessert. They had kids. They ranged from about 6 to 11 per household. And everything was accessible, even the packaging. And the way we made it accessible was asking those participants, what are your needs food-wise? What are your needs? How do you need to open things, close things? And we did it around the weekend or when when someone needed something. And we actually did use those government boxes. We were able to use them, and I was able to get them to make meals. We crowdfunded for resources, and I used my family's recipes. And and that was the thing. It included that because you shouldn't have to say, oh, well, exactly. Like and also that framing of beggars can't be choosers the idea of framing that a person, right, who needs food but also wants, it's not a luxury just for something that you know, just a small thing that you want. So
We all
framing
have that same need. Everybody.
Exactly. So I think the saying is there are certain aspects where that is rings true, but if people have that paternalistic idea of what I determine what's best for you, and I make it determine based on your needs, what your wants and desires should be, then that's where the problem comes in.
Yeah, and I think another thing that I thought of too while you were speaking was access to food that for people who have restrictions around their diet, which is also a huge issue we face at pantries, particularly for people with disabilities and for people who want halal, kosher. Just having access to those types of foods is difficult because they're not often what's provided by the government, and they're more difficult to receive from food rescues and things like that. And so just want to push that up as another barrier that that a lot of people with disabilities face at pantries.
Yeah, there was and so sometimes we would, or when I was cooking something, I'm like, okay, well, I'm making for 4 families. I know this person can't have dairy, or something happened with their doctor, or they've changed medications. That has a huge impact. I know the medications I take have impacted what I eat, how I eat, when I eat, all of those things. So again, thinking, and also again, packaging, the way things are packaged, the way things are, you know, it's an entire system and idea and conversation. That's the whole point, that it really should be a conversation about these things that we need to be having. It's not just like a top-down aspect, right? It is more of a conversation, a whole communal understanding of what we need. And we just don't, this thing about accessibility, capital A, accessibility, ADA, we don't want to get sued. It's how do we give people needs that are accessible to them, whether they have like documentation or whether they need documentation. How do we get out of that particular mindset? And I think that's where the real that's where we can really come to some solutions that are sustainable and, you know, centered around the needs of the people we're serving or that we're working with.
There's a local organization in Pittsburgh. They are with one of our hospital systems at Allegheny Health Network, and they have what's called a healthy food center. So it's a particular type. It's not meant to be like all inclusive for everyone with every type of food insecurity. But basically your doctor can prescribe you, like write you a prescription to participate in this program. And they have one of these at every single hospital in the area. And Pittsburgh has so many hospitals. And the program is run by registered dietitians, and they get a lot of their food from 412 Food Rescue, which is our local and also a very big, which everyone on this call knows about, organization that does, you know, food rescue and redistribution. And so they get almost all of their fresh food from 412. And then the dietitians take that food and they create recipes on recipe cards that are one-pot meals. And all the food is always stuff that's like in season. So they're constantly like working to change out these recipes, do them in a way that works for people. Like they'll say you can do it in a crock pot, or you can do it on a like big pot on your stove, or, you know, if it's something that doesn't have meat, then there's like, if it's like a vegetarian dish, a lot of times there's a, you know, like a microwave option. So kind of just like wrapping around, you know, the whole process, what it takes to go and get food and then bring it home and store it and prepare it. That's when that little A accessibility starts to come in.
I know we have to wrap up, but there is one more question in the chat.
Yes.
So what are some common fixes to help make more options at food banks more accessible for people with disabilities, packaging, storage?
I think one thing is seeing what people want or need, or cultural significance. So we just had a pantry. So like I said, I'm in Chicago with Pilsen, which is a famous Mexican neighborhood. They had a pantry, and then they had to move for various reasons. You can look that up. And they recently reopened a new one, and they not only do have food services, right, with culturally relevant food. That's another thing, culturally relevant food. But also they have other services for like clothing or other agencies people may need. So they're helping you. Think of it as like, if this person is coming to you and they have this need, what other needs do they have, right? Is there a network of needs that you can help provide for them? And how can you create a community around this that destigmatizes food access and also can increase like people's not only like use but effective use and asking for help. It is so hard already to ask for help, and like means testing and all these other kind of barriers just increase, you know, people's feelings of isolation and, you know, things like that. So one thing we can do to make it more accessible is to make it more accessible from a human to human perspective, and then also make it more accessible for the other things people may need or want. So listening to what people have said, like on the south side of Chicago, I know there have been issues with food pantries with milk. So many with milk, or just things that are not given in time, or that the pantries on the northern side, which are better off, they have better access, but more restrictive access. So now you have to have all these documentations. You have to live in a certain neighborhood, things like that. So I think that's another one. Oh, yes, choice is dignity.
Mhm.
Yeah. Yes.
So we're getting the ding that we have to wrap up. Just letting everyone know. We gotta.
Well, thank you all for being here. I think everyone enjoyed, hopefully, hearing about us talk about, you know, the dignity of choice and being in communities, right? Like being interdependent. We're all interdependent. It's not just our like little subgroups. We all need this, so we should all help each other get this.
Exactly.
Yeah. Thank you.
Thank you all so much.